How do you correctly touch your stomach for a pregnancy test?
Hello and welcome to this step-by-step guide. Today, we will be discussing how to correctly touch your stomach for a self-palpation pregnancy test. This technique isn't a definitive test for pregnancy, but it can give you some clues. However, it is always recommended to seek professional medical advice and use approved pregnancy tests.
What is a self-palpation pregnancy test?
A self-palpation pregnancy test is where you gently feel and press your lower abdomen to detect physical changes that might indicate pregnancy. Remember, this method does not replace medical pregnancy tests and is more appropriate in later stages of pregnancy, not early detection.
When should I start checking?
The best time to start checking is around the 20th week of suspected pregnancy. Prior to this, the uterus is usually not large enough to detect through palpation.
How do I perform the self-palpation?
Let's get to the step-by-step procedure. But remember, it's essential to be gentle and avoid any forceful pressing which could harm you or potentially the fetus. 1. Wash your hands thoroughly. 2. Find a comfortable position. Lying down on your back is often the easiest. 3. Relax your abdominal muscles. This is essential for an effective self-examination. 4. Start palpating your lower abdomen. You can do this by applying light pressure with your fingertips, starting from the belly button and moving downwards. 5. Feel for a hard, round presence. This could be the top of your uterus, which is known as the fundus. If you're pregnant, your uterus will rise above the pelvic bone around the 12th week and reach the belly button around week 20.
What should I be looking for?
If you're pregnant, you're looking for a hard, round bulge in your lower abdomen which could indicate the top of your uterus. As the pregnancy progresses, this bulge becomes more pronounced.
What are the limitations?
This method is not a definitive or early detection method for pregnancy. Some women might not detect any changes until much later in their pregnancy, while others might mistake other conditions such as fibroids or bloating for pregnancy. Always consult a healthcare provider for reliable pregnancy confirmation. Thank you for joining this guide on self-palpation for pregnancy. Remember, this is not a surefire method for confirming pregnancy and does not replace medical advice or approved pregnancy tests. It's always important to consult with your healthcare provider for accurate information and guidance. Stay safe and healthy.